Welcome back to the Now Morning Show. It's time for us to shine a spotlight on those who have been awarded for their excellence.
The President's Awards for Innovation in Service Excellence, the Praise Awards, are in their 8th year, and this morning we will be checking in with some of the recipients, particularly Dr. Rajiv Kissoon, the Registrar in Medical Oncology at the NWRHA. They would have been given the Internal User Experience Award, and therefore will give us some insight on what it's like to be a recipient of the Praise Award. Good morning, Dr. Kissoon, and welcome to the Now Morning Show.
Hi, good morning to the crew and to all of our viewers. It's a pleasure to be here this morning to chat with you all.
It is a distinction that we are very pleased to have, simply because these sorts of innovations impact each and every one of us, but sometimes we don't quite understand what exactly they are. So while I congratulate you for simplifying the process, tell me more about the project that would have earned you the actual award.
Sure. So if any of you all may have been to a public health institute in the last 5 or 10 years, you know that everything is done on a paper-based system, in the past at least. So everything from being registered as a patient is done on a manual system. There's a physical file with pages where doctors and nurses will write notes on, and all of your lab reports, etc., will be printed. Your radiology reports, everything would have to be printed and then collated in this one physical file. Right. As you can imagine, that physical file represents a bottleneck to service because there are multiple members of the healthcare team that all need access to this file, and it's a physical thing that's available in one location. Also, it's not the most secure thing for your personal health data. As you can imagine, physical file, there's access to anyone who's in vicinity that can view your file. What we've done at the Northwest Regional Health Authority, which was originally implemented as a pilot project in St. James in 2019, was to switch over to a comprehensive health information system, which is a web-based digital platform. Basically transforming all of that paperwork into a more efficient electronic system where all of the patient's file is available online at the click of a finger and is available to be viewed by multiple members of the team at the same time. Everything is integrated in terms of the lab reports, and now we have radiology reports being integrated as well. So essentially, it allows us to be a lot more efficient on the back end, the part that patients may not see, but which forms a big part of the work of the healthcare team, physicians, nurses, everyone down to the pharmacists. So our pharmacy system is also digitalized, and this allows us as well to be able to manage administratively much better, because the pharmacy is able to see when drugs are going to expire, when patients have last collected medication, when next they're due. So everything is definitely more efficient with the new system.
Well, that it's definitely deserving of that sort of award, and there is no question as to how it's going to impact the service provided, the speed at which it is done, and really innovate our lives, the citizenry and the medical associations altogether, entirely. But this particular award is very specific to that industry. It is one of 2 of the President's Awards for Innovation, the second of which is the Citizen Experience that was given to the Ministry of Education for their project, First Year Infant Registration System, T&T, first with 2 T's, which also is going to innovate the process of having young children come into the school system. The recipient or the representative there will be Mr. Aldwin Webb, the ICT Director in the Ministry of Education, who will give us some more insight on that, as well as he now joins us via Zoom this morning too. Mr. Webb, can you hear me?
Yes, I can. Good morning.
Good morning and congratulations. I may have given a little bit of a summary, but can you as well give us a little bit more insight into what exactly FIRST is and how it actually impacts the citizenry and proves that innovation?
Of course. allows parents to register their children into school. Much easier process. It removes the paper-based process. It allows the parents to register their children at any place, anytime, at the comfort of their home. So this is a very innovative, helpful process for parents, and we are so excited to be able to assist the public in this way.
Absolutely. Now, the two projects are definitely embracing digitization altogether, which is a big challenge because that's a culture change as well as a shift in how we navigate these systems for a more efficient turnover. Dr. Kissoon, in terms of the way that it impacts the workplace first and foremost, can you describe what your fellow employees or other persons in the workplace have experienced thus far?
Sure. Now, of course, with the implementation of any new system, there are going to be some minor hurdles and adjustments that have to happen, and that's part of the process. But what we've seen is that once users were trained and started doing it in their daily practice, it became second nature very quickly. And because it was much more efficient than what was there before, you start to see that not only are people adapting and adopting, but they're also starting to champion it and say, hey, this is actually making things a lot more efficient for us. You know, from the instant that I put a prescription on the system, the pharmacist has access to it. If there's a question or query, you know, they're able to reach out to me immediately. And before that patient even reaches across the pharmacy, you know, I can make adjustments. And that's something that, you know, at many different points throughout the system where there would have been, you know, bottlenecks, you know, the navigation of the patient through the system is so much better at St. James. And I know that this will be implemented soon at Port of Spain General Hospital as well, and throughout the RHA at a later time.
Of course, of course. And Mr. Webb, in terms of the similar results, it will be from the people who actually utilize it. Have you gotten feedback thus far as to a similar attitude, perhaps, being able to adopt and even champion just yet?
Yes, usually before the system, the parents would have to form long lines at various schools to register their child. So if it is they want to register their child in 3 different schools to have the opportunity to do so, they have to physically.
And Mr. Webb is frozen. I imagine he was about to say physically come in, and that in itself is going to be an obvious advantage that has come in as a result.
Physically go to these schools and line up, and that used to take a significant period of time.
You had a little bit of a frozen problem just then, Mr.
Can you
Webb.
hear me now?
I am hearing you well. So it is very
great.
obvious that the time saved is going to be a big factor.
Exactly.
But yes, continue.
Exactly.
Tell us. What has been the feedback?
Now the parents could be able to do that same exact process in a matter of minutes from the comfort of their homes. So that has been extremely helpful. Additionally, when they register their children, they get an alert. And when the school makes the selections, they are aware immediately of what school selected them to enter and to register. So that kind of feedback is very helpful for the parents, where they usually will have to wait a while to get any kind of feedback. So that kind of innovation and that system makes the lives for the parent much more easier.
Now, gentlemen, I pose this to you both, and we will begin with Dr. Kissoon in saying what you think the organization will achieve or continue to, well, rather, having won the award, what sort of a future are we looking at for each of these institutions? There is a lot of expectation now, a lot of attention, but it's absolutely a positive thing. So, Dr. Kissoon, how would you say we can look forward to these innovations impacting the future of the NWRHA?
Well, I think for many people in healthcare, you know, what we do well doesn't always make the headlines. So I think the NWRHA aims to show the public that there is advancement happening in the public healthcare sector, and that it is improving the delivery of healthcare to patients. It is safeguarding patient data. It's making processes more efficient. And the result of that is that patients will have a better experience. So I think one of the things that we want to do with this award is to show some of the positive changes that's happening, and also to give the public confidence that that is what we're aiming to do going forward, which is to continue to advance the delivery of healthcare services, particularly in the Northwest Regional Health Authority, with more efficiency. We have a slogan, and it is more patient work, less paperwork. So I think that's one of the things that is going to be the tenet of how we move forward.
It absolutely helps that slogan to be even more true. Mr. Webb, would you concur that similarly you are able to put some words into action in a better way? How do we see this impacting the future of your institution, the Ministry of Education?
Most definitely. With our drive towards digital transformation, we have been focused on people-centered, people-focused, and providing solutions to make education more focused on the child and to make the public services more available to the public. So in that drive, we have been focused on putting all our solutions, all of the services for the Ministry of Education online and available to the parents and teachers and students. And this has been a focus of Ministry of Education. So over the next year and 2 years, you will see a lot more solutions coming to make the lives of parents, teachers, and students easier.
Well, Gentlemen, I genuinely thank you for joining us this morning to give us the insight, because as you said, Dr. Kissoon, so many things are happening behind the scene that we don't always see. So thank you for putting the light on your accomplishments and for continuing to drive innovation in your various fields that we, the people, get to enjoy. Have a great morning, gentlemen.
Thank you.
Thank you.
Of course, Dr. Rajiv Kissoon, the Registrar in Medical Oncology at the NWRHA, giving us some insight into their successes, having been one of the recipients of the prestigious Praise Awards. And Mr. Aldwin Webb, the ICT Director in the Ministry of Education, who would have also presented innovations that we, the citizens, will enjoy. I think, interestingly, while one is immediately impacting the internal happenings, the other externally impacts the public more directly, but both speak to innovation, ease of use, and ultimately public sector improvements. We can always appreciate that.
I agree with you 100%.
Well done.
The ease of use, definitely, and also just being able to now have things streamlined, which is going to make such an incredible difference when it comes not just to those who are working behind the scenes or on the scenes, we should say, but for those of us who are blessed enough to utilize those services. Something I found quite interesting as well, not verbatim what Dr. Kissoon would have said, but specifically speaking about the fact that, you know, not everything that is done always makes it to the fore. And it's really something that we should also keep in mind, as, you know, we're very quick to speak about things that happen, and when they don't serve, let's say shine a negative light, we need to keep in mind that a lot of good things are happening as well, and that's why things like the President's Award for Innovation and Service Excellence make a huge difference.
Of course, it is in conjunction with the IDB as they continue to work within the region. And while 12 finalists were selected this year, 6 projects in each category, those are just 2 of some of the winners. So you guys could take in more information, of course, on the TTT Media Network as we give you more coverage of the Praise Awards and their recipients, the innovations and more. But you need to stay tuned to the Now Morning Show as we've got more after these messages.